Hello there, and welcome to part 2 of our nursing home, long-term care and senior health video series. Okay, so how does gender and ethnicity differ in regard to nursing home residents? More women reside in nursing homes than men. Roughly 59% of short-stay residents and 66.6% of long-stay residents were women, the NCHS reports. Additionally, the report notes non-Hispanic white people accounted for 73.9% of nursing home residents. The racial/ethnic mix depends on the community. More urban areas have a more racial and ethnic mix. The variation in nursing home residents' ethnic backgrounds is, in part, related to cultural differences and a lack of providers who speak the language or can cook the cuisine. Some cultures also place a big emphasis on families caring for their elders at home, although that has been changing over the years, and now more different types of patients are moving into nursing homes. So, how long is the average stay in a nursing home? Because of the wide variability of care needs across such a diverse population, it can be difficult to determine how long you'll need care in a nursing home. However, the Administration on Aging reports that women on average need long-term care services and support for 3.7 years, while men average 2.2 years. About 20% of people aged 65 years old will need long-term care support for longer than 5 years, the AOA notes. Approximately one-third of people the same age won't need support at all. Those figures include all kinds of long-term care, including assisted living. For nursing homes specifically, the average stay is 1 year, and about 35% of people use that type of care, according to the AOA. Because aging in America can be a socially isolating experience, UR routinely talks with her patients about their plans for the future, especially if they're about to undergo an elective surgical procedure or foresee that they might need extra short-term care at some point. Now for some key points on the costs and paying for a nursing home. Another popular misconception is that Medicare, the federal health insurance program for people ages 65 and older, pays for residency in a long-term care facility. In fact, Medicare only pays for the first 100 days in a nursing home or skilled nursing facility, and only if certain criteria are met, according to experts. For instance, the patient must have been hospitalized for at least 3 consecutive days before transferring to the nursing home. Medicare will pay for the first 20 days of care in a skilled nursing facility at 100% coverage. However, for days 21 to 100, there is a daily copayment, which in 2023 is $200 per day. After day 100, Medicare coverage ends. When you get to day 101, other forms of payment need to be in place. The coverage rules for Medicare Advantage plans are different, so check your specific coverage plan for details. Because Medicare doesn't pay for long-term care, people who need nursing home care must pay privately. Finding a way to pay for long-term care can be a big problem for many people, especially given the high costs associated with such care. According to Genworth Financial 2021 Cost of Care Survey, the most recent data available, the median annual cost of skilled nursing in a private room at a nursing home will set you back $108,405 per year, versus just over $94,000 for a semi-private room. But prices can vary a lot depending on where in the country the community is located and which services a senior is using. Long-term care insurance policies may be another option to pay for nursing home care, but these policies can be prohibitively costly for many. In most cases, people pay out of pocket until their resources are used up, at which point Medicaid, a joint federal and state program providing coverage to low-income individuals, kicks in to cover costs. In fact, Medicaid is the payment source for the majority of nursing home residents, with 62% using this means, according to the NCHS, although the rules do vary from state to state. So it's important to talk with an advisor to understand your options. This concludes part 2 of this video series on nursing home, long-term care, and senior health. Please join us for part 3 for continued information on these topics. For more information, or to better understand what your retirement plan could look like, take the questionnaire linked in the video description.